Hello, everyone. Today, we hope to improve your knowledge, attitude, and comfort levels when caring for the LGBTQ population. This research study is conducted by Joseph, Maria, and myself, Ashley. We hope that you enjoy our presentation. Our objectives for this research study is for students to be able to use appropriate pronouns when communicating with clients, discuss top health issues within the LGBTQ community, discuss gender identity development through the genderbread model, use appropriate nursing implementations regarding LGBTQ patient care. We hope to improve this cultural competency within both nursing education and practice. As Dr. Martin Luther King Jr. once said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. We have to raise our standards as future nurses in regards to the LGBTQ community.
We based our presentation off of the Healthy People 2020 goal, which is to improve the health, safety, and well-being of lesbian, gay, bisexual, and transgender individuals. It is important to understand LGBTQ health because as future nurses, we will have to care for patients from this community. Therefore, it is important to use appropriate pronouns when communicating with clients, be aware of top health issues within the LGBTQ community, be aware of gender identity and development, and use appropriate nursing implementations regarding LGBTQ patient care. But overall, education in this area will help improve clinical interviewing skills and provide competent care, improve the LGBTQ health research, and lastly, help healthcare professionals reduce stigma and discrimination.
Hello everyone, we're going to break down baseline key terms that every healthcare provider should be aware of when practicing in the outside world. Before I mention these terms, it's always nice to think of people as fluid. Everyone is different, everyone is evolving, just like the list of key terms I'm about to discuss. Just like science, there are new things being discovered every day, so it is always nice to note that everyone has an individual responsibility to brush up and stay up to date on these terms. Just remember to always be polite and respectful when practicing, and use terms that the person prefers. So let's jump right in. You may see LGBTQ, LGBTQ+, or even LGBTQIA, but don't be alarmed. All of this can be used interchangeably. I am going to introduce these terms in order that is displayed on the screen. Lesbian. A lesbian is a female homosexual, a female who experiences romantic love or sexual attraction to other females. Gay. Gay can be used interchangeably between the genders. Gay is a term that primarily refers to a homosexual person or the trait of being homosexual. Gay is often used to describe homosexual males, but lesbians may also be referred to as gay. Bisexual. Bisexuality is romantic attraction, sexual attraction, or sexual behavior toward both male and female, or romantic or sexual attraction to people of any sex or gender identity. This latter aspect is sometimes termed pansexuality. Transgender. Transgender is an umbrella term for people whose gender identity differs from what is typically associated with the sex they were assigned at birth. It is sometimes abbreviated as trans. Queer, or to better understand, Q for questioning, an adjective used by some people, particularly younger people, whose sexual orientation is not exclusively heterosexual. Asexual. Asexuality or non-sexuality is a lack of sexual attraction to anyone, or low or absent interest in sexual activity. Intersex. Intersex is a variation in sex characteristics, including chromosomes, gonads, or genitals that do not allow an individual to be distinctively identified as a male or female. Cisgender. Cisgender is a person, or cis, a person whose sense of personal identity and gender corresponds with their birth sex, or the sex that was assigned at birth. Stigma, a mark of disgrace associated with a particular circumstance, quality, or person. Ally, an ally is a person who supports equal civil rights, gender equality, and LGBTQ social movements, challenging homophobia, biphobia, and transphobia. Not everyone who meets this definition identifies as an ally. Hello everyone, and in this slide we're going to be discussing terms that are easier to understand based off the diagram on your screen. We'll be discussing gender identity, attraction, sex, and gender expression. Gender identity is who we are and what we personally identify as. It is nice to note that this term is fluid and deals with what the individual thinks and says. Gender identity is our psychological sense of gender or knowing oneself. Attraction. Attraction is the different ways we feel pulled to other people, often categorized based on their gender and the gender of those we feel drawn to. Attraction can be categorized as sexual orientation as well. People experience attraction in a lot of different ways. Two common ways people describe attraction is sexual and or romantic. You can think of sexual attraction as the drive to engage in physical innate behaviors like touching, kissing, or intercourse, and romantic attraction as the drive to engage in social behaviors like flirting, dating, and later, marriage. Sex. Sex is the physical traits you're born with, or in other words, your physical sex characteristics. It can be both the primary traits we're born with and or the secondary traits that might be developed later in life. With anatomical sex, the first thing that people think of are genitals and or reproductive organs. But lots of other things make up what we call sex, including our body hair, hip to shoulder ratio, chromosomes, pitch of voice, and etc. Gender expression. Gender expression is all the different ways we present ourselves through our actions, our clothing, and our demeanor, and the gendered ways those presentations are socially interpreted, like masculine or feminine qualities. It is easier to think of it as gender identity has to do with whatever the person identifies as, and gender expression has to do with the degree in which you come off and can be displayed as more masculine or feminine qualities to society. These terms are here to better understand the dialogue that is being had between sex, gender identity, and gender expression. It is good to be aware of these terms because, for example, because our sexual or romantic attraction might be to a particular part of gender, someone might be attracted to a person who identifies as a woman but expresses masculine qualities or vice versa. As stated previously, everything about this community is fluid and ever-changing, but having a baseline knowledge of these topics can only better our relationships with this community.
Evidence of stigma and social marginalization surrounding LGBTQ individuals can be supported through numerous studies. In a few of the studies we included, LGBTQ individuals report excessive amounts of rejection, disrespect, and ignorance from healthcare workers. This often leads to lower rates of disclosure of patients' identity and more negative perceptions of healthcare and service providers. In another study, 80% of the first-year medical student participants exhibited negative evaluations of lesbian and gay people compared to heterosexual people. 80%. As well as explicit homophobia continues to exist in healthcare settings, which include verbal and nonverbal abuse of LGBT patients, and a lack of institutional policies and practices that would enable equal healthcare opportunities for LGBT individuals. This often leads to verbal and nonverbal abuse of LGBT patients and jeopardizes their potential to continue seeking healthcare. Due to a lack of LGBTQ education, studies have reported some shocking statistics. According to Khalil, 52% of participating medical institutions report no LGBT training, while according to Gagnon, over half of respondents reported having never received training for cultural competence in relation to LGBTQ populations, which makes us question how they can properly treat LGBTQ patients if they were never trained in that area. While, according to Salkind, after LGBT teaching interventions, including a physical assessment, confidence among medical students increased from 75% to 93%. It is evident that with training, students are more confident in assessing LGBTQ patients and assist in making a proper diagnosis.
As a future healthcare professional, I feel it is important for me to know about my patient's sexual orientation and gender identity. This will allow me to know key health factors when assessing someone from this community. This chart is a simple breakdown of top health issues that LGBTQ patients face. It is broken down by category, and it shows what each individual is more susceptible to experience. Key things to keep in mind when caring for an LGBTQ patient. Did you know that lesbians are at a higher risk for breast cancer? They're also less likely to bear children and less likely to see a doctor and have a routine screening. Lesbians are 1.5 to 2 times more likely to smoke than heterosexual women. In addition, 56.4% of lesbian or gay adults have experienced intimate partner violence. Many men are exclusively the insertive partner or the receptive partner. Why is this important? Because the receptive partner is more susceptible to certain sexual transmitted infections and acquiring HIV. Bisexual women are more likely to report engaging in sex with HIV positive men and have multiple sexual partners. Being educated on these health issues for the LGBTQ individuals will allow us as nurses to provide better. These quotes are few of many heartbreaking experiences individuals of the LGBTQ community go through. One patient shares, "That hurt. I cried for days over that because he was the one I really wanted to take care of me because I really trusted him. But he said he didn't believe in it, that he would not do it." Another patient shares, "I called around and I said, 'Do any of the doctors do HRT?' And they're like, 'Yeah, do you need estrogen? Do you have problems with that?' And I was like, 'No, ma'am, I don't.' I was like, 'I need testosterone.' And she was like, 'What?' I said, 'I'm a transgender patient.' And she said, 'Oh, we just don't do that.' Click and hung up. This shows evidence that not every individual is treated the same in the healthcare world. Many are rejected just because doctors are unable to set aside their personal beliefs when it comes to gender.
In this slide, we are going to discuss the components of what an appropriate interaction is with an LGBTQ client. One must avoid making assumptions about sexual orientation and treat all clients with respect. For example, just because a woman has short hair does not mean she is a lesbian, and just because a male has feminine qualities does not mean he is gay. One must be open-minded at all times and actively listening throughout. It is always nice to have LGBTQ resources on hand to further elaborate whatever it is that is being discussed. Use gender-neutral language, like, what is your preferred pronouns? Do you have a significant other? Focus on sexual behavior, not sexual orientation, like, are you sexually active? Would you like to discuss birth control? And if so, what type? Do you practice safe sex? We have included a scenario of what a healthy relationship between a provider and an LGBTQ client should look like. It involves a provider who is new with caring for an LGBTQ client, yet they still remain open-minded and are open to learn more about their pronouns. Sarah is visiting a therapist, Dr. K. At the time of Sarah's last visit, she used him, he, and his pronouns. Dr. K enters the room and greets Sarah. "Hello, Sarah. How are you doing today?" "I am doing well. How are you?" "I am doing all right myself, Sarah. Before I assume, I wanted to check in with you first. What are your pronouns?" Sarah: "They are Z, here, and here's." "Thank you. I have never used these pronouns before, so please forgive me if I make a mistake." No, Z, here, and here's are used in a trans community instead of he, she, or him and her. These pronouns offer accuracy for someone who doesn't identify by the male, female gender classifications, or is currently going through a transition. The takeaway from this interaction is that after the provider asks the patient for their pronouns, they respectfully state that they are new to using these specific pronouns and apologize for any future mistakes.
This is a list of the various pronouns. It is necessary for nursing students to discuss these because they will face patients who prefer these specific pronouns. For example, we are all familiar with he, him, his. Examples of these are, he is in the waiting room, the doctor is ready to see him, that chart is his. Next, she, her, and hers is also another pronoun that we are comfortable with and have seen in a hospital setting. Examples of this is, she is in the waiting room, the doctor is ready to see her, that chart is hers. However, some patients prefer to be gender neutral. A gender neutral pronoun is a pronoun which does not associate a gender with the individual who is being discussed. The most common ones that healthcare workers have come across in the hospital setting are they, them, theirs. They are in the waiting room, the doctor is ready to see them, that chart is theirs. Then we have Z, her, and hers. Z is in the waiting room, the doctor is ready to see her, that chart is hers. Using appropriate pronouns with a patient will allow them to feel more comfortable, and it shows respect on our end as nurses. This will result in better patient and healthcare provider relationship and promote adequate patient satisfaction.
Now you may be wondering, what can we do as future nurses to include LGBTQ in our nursing education? First, we need to recognize that this is an active issue and that we can no longer continue the LGBTQ silence in nursing. In order to improve on this issue, first, nursing curriculum needs to improve. Second, nurses need to advocate for LGBTQ cultural competency training in hospital settings. Third, researchers should explore the effects of economic and social barriers on the LGBTQ community. And lastly, researchers should investigate the needs of other marginalized populations, such as intersex and transgender individuals. Lastly, here are some additional resources that we will make available to you on the debriefing page that you can access through the links provided. We thank you for watching our presentation and hope that you will take it with you in your future nursing practice. Please continue to answer the post-test questions before exiting out of the survey.